I did a literature review, and there is a study on frequency of headache, and it was done by Delossi and the group in Italy. The study was done on March 27 to April 18, and they showed that there was a decrease in headache frequency compared to before the pandemic. But I checked another study on stress, but it was not done on migraine patients. It was on general population. It was in Switzerland on 10,000 people. And they found that in about 25% of the individuals, stress decreased during the pandemic. And I had a talk with some of the colleagues there. They're not, I just know them. I asked them some questions, and they said we were interested in this finding, like 25% had less stress compared to before, but about 50% had more stress in Switzerland in the 10,000 participants. And they found some reasons like change at work, problems with childcare, and not being able to spend more time as the reasons for increasing the stress. So maybe we have to check these factors in our patients, in migraine body users, if we are gonna have a sample, for example, and send them questionnaires. So ask these questions and check if there is any reason for decreasing or increasing their stress level. Not stress level, their stress as a trigger. I think maybe we have lots of research at the moment, so we have to wait for the results. But the real effect of pandemic, I think, on the disease should be checked for the whole 2020. And I don't know if we are going to have any vaccine or any ending for this pandemic, but just one specific time is not enough, and we need a pattern for the whole year, especially for 2020, which most of the countries were influenced. In some countries, they had lots of peaks. Like I know from Iran, they experienced several, 2 or maybe 3 peaks. So we need to check it. But what I'm thinking, it must be done on people who are diagnosed by neurologists as a migraine patient, to have proper results and be able to check the results and say, okay, this is something on migraine patients.